Hey my awesome people, this is Dr. Shivam and we are going to start a very important series for you, a fast revision which is included in the high yielding stuffs course. So basically your NEET PG examination is less about you but more about you relative to others. That means what matters is how much less mistake you make relative to others, and the easy option by which you can make less mistake than others and improve yourself is to work upon your mistakes. And how it will happen? Very easy. It can happen by revisions. So whatever you have read, you should revise. So this word has the key to success for you in your examination. Revise the studied part and cover the part which you have in fear. That means cover or relieve your fears. So first analyze what all fears you have, write them down and kill them up. So this I tell to my enrolled student, that kill your fears. This is the thing which will help you to upgrade your ranks. So today we'll be discussing a very important part from ENT along with its very important MCQs. So stay with me patiently. So if I start with the anatomy of nose, the nose consists of an external nose and internal nose. If you see the external nose, it comprises of the upper 1/3 bony and lower 2/3 cartilaginous. So basically it is a osteocartilaginous framework. Why I am saying osteocartilaginous framework? Because the osseous, the upper 1/3 is osseous and lower 2/3 is cartilaginous. Now they ask MCQ about the different parts, that is the osseous and the cartilaginous. So if you see the parts of osseous, the upper 2/3 consist of, so they particularly ask this, that is two paired and one unpaired bone. So what all are they? Two paired is the two nasal bone and two frontal process of maxilla, and one unpaired is nasal spine of frontal bone. So now it is clear. Once you imagine the things, it will become clear. So two nasal bones, if you feel your the nasal part, the bony part, it consists of two nasal bone which is attached to the two lateral process of maxilla, and superiorly it has a nasal spine of frontal bone, and the joining of these two nasal bone with the frontal bone is called nasion. So nasion is a separate question, that it is the intersection of the two nasal bone with the frontal bone. So if you assume this is your nasal bones, okay, this adjacent to is your frontal process of maxilla, and this is your nasal spine of frontal bone. So this forms your upper 1/3 bony part. Now moving to the cartilaginous part, cartilaginous 2/3 is more important and relatively difficult than the bony part. So now here the another MCQ is, it consists of three paired and one unpaired cartilage. So if you see the names, the upper lateral cartilage on each side, okay, the two lower lateral or LR cartilage on each side, two or more sesamoid cartilage or lesser LR cartilage, and unpaired septal cartilage. So these forms the three paired and one unpaired cartilage which forms the lower 2/3. Now I was relatively little slow as I was discussing the anatomy, and anatomy is something which you need to understand because it forms the difficult thing. So here you can see in the above picture, upper 1/3 is bony and lower 2/3 is the cartilaginous part. Okay, so if you see the inner, the nasal cavity, it consists of different turbinates which encloses the different meatus. So if you see the lateral wall of nose, it has three turbinates. So what are those three turbinates? These are superior, middle, inferior, and sometimes a fourth turbinate is also seen called supreme turbinate. So a fourth turbinate is also seen called supreme turbinates. Now what important MCQ they ask out of this is superior, middle, and all the other turbinates are the part of ethmoid bone, whereas inferior turbinate is an independent bone, that is, it is a separate independent bone which is attached to the ethmoid bone. Okay, so this was a separate MCQ they very frequently ask and is relatively easy, so you cannot afford to miss this. So all turbinates are a part of ethmoid bone except inferior turbinate. So total 3 turbinate if you see as told, and the pH of nasal cavity is 7, amount of water secreted from it is 1 liter per day. Inferior turbinate ossification starts from 5th month of intrauterine life. There is a physiological alternate congestion and decongestion of the nose. You must have also observed one of your nostril is blocked and one is open. So one side congestion, other side decongested, and they ask, what the question they ask is, what is the duration? So it is 2.5 to 4 hours. So it alternates. So nasal cycle alternates every 2.5 to 4 hours. So this is an important thing to note. And the other thing is the superior part of the nasal cavity is a very important area because it is the upper 1/3 part which constitute the olfactory area, and the area is 2 to 5 centimeters square. So 2.5 centimeters square. So this forms a very important area because it is responsible for the inhalation, for the olfaction, and it is a very sensitive area because also called dangerous area of nose. The olfactory, through the olfactory nerves there is a direct connection with the arachnoid subarachnoid membrane of the, that is to the inside of the brain. So infection can go from the nasal cavity into intracranial space and cause meningitis and other things. Other thing is the olfactory nerve pass through the cibriform area, which is a very sensitive and very thin layer of bone and prone to injury. So CSF rhinorrhea and other things also occur from this site. So we'll move to the other part, and if you see the paranasal sinuses. So paranasal sinuses, the important sinuses for you to note are maxillary sinus, frontal sinus, anterior and posterior ethmoid, and the sphenoid sinus. So if you see the location of anterior, middle, and posterior ethmoid, this is your nasal cavity, anterior part, posterior part, this is your orbit, and anterior, middle, and posterior ethmoids are located here. Although middle ethmoid cannot be seen when you do surgery, but anterior and posterior ethmoid you can delineate. How you can delineate? The anterior ethmoid cells are separated from the other, that is the posterior ethmoid cells, from the basal lamina. So this is basically the horizontal part of the middle turbinate. So horizontal part of the middle turbinate, that is the ground lamina or basal lamina, separates the anterior ethmoids from the posterior ethmoids. So it is a separate and important question. Now different sinuses have different dilation, like sphenoid sinus lies 1.5 centimeter above the superior margin of the posterior choana. So if you move, when you do the first pass of diagnostic nasal endoscopy, you reach the choana. So choana, from choana if you go 1.5 centimeter above, you will find the sphenoid sinus opening near the septum. So this is posterior superior to the nasal cavity. Other MCQ is, the largest paranasal sinus is maxillary sinus having 15 ml of capacity, and most functional and pneumatized is ethmoid sinus having almost around 15 air cells. Now this is something which forms a large chunk of questions in your examination, or you can say this whole part. Why I am saying this is, they ask different MCQs from this. If you see, they can ask which of the following sinuses are present since birth? So maxillary sinus and the ethmoid sinus are present since birth. Okay, while frontal and sphenoid develop on later life. Now they can ask you कि which is the sinus which is last to develop. So it will be the frontal sinus. So it is the last to develop or last to be seen in radiology. Okay, so frontal sinus is last to be seen. Another thing which I would like to tell you is, remember a numerical value of 4164. Why? Because they ask the radiological appearance of the sinuses, and 4 is the 4 months for maxillary sinus, 1 year for ethmoid sinus, 6 year for frontal sinus, and 4 year for sphenoid sinus. So this also makes the frontal sinus the last sinus to appear. So you will get the questions while I discuss the MCQs. Now, one of the question that has been already asked by the NB people is, the water's view is best seen in. So I shouldn't name the exam because it is banned. So you can say the in recent examination. So is the water's view is best view for maxillary sinus. So even if this is a very simple question, you can, or people have mistaken it even after knowing this. So revision is important. Water's view for maxillary sinus, Caldwell-Luck views for ethmoid and frontal, and lateral for sphenoid sinus. Okay, so sphenoid sinus can also be seen if you do a water's view mouth open, but lateral is basically best for sphenoid sinus. Okay, so if I ask you a question on water's view, all sinuses are seen except maxillary. Yes, it is best for it. Frontal, yes. Sphenoid, yes, in mouth open, but posterior ethmoids cannot be seen. Okay, for ethmoid you have to do a Caldwell-Luck view. Now frontal sinus is the sinus which is having maximum variation. So while you do the endoscopic sinus surgery, you get maximum variations for frontal sinus. Okay, so frontal sinus development is physiological up till 4 years, and if you in a question if it says it is greater than 4 years, then there is something pathological going on with the frontal sinus. Now most prominent part of forehead is called glabella, and upper edge of the bone is called radix or root of the nose. Nasion is the angle between glabella and the radix. Okay, so it is around 115 to 135 degrees, and bony cartilaginous junction is called rhinion. So there are different terms, less possibility of them being asked, but you must know them. Okay, now relating to the paranasal sinus and its some cells, the bulla ethmoidalis and the concha bullosa. So you should know about what is bulla ethmoidalis. So it is the largest air cell, or you can say the anterior most ethmoidal air cell, which is also the largest air cell. Okay, so once you do the diagnostic and endoscopy, I would suggest you to search in YouTube like diagnostic nasal endoscopy or nasal endoscopy. There you will see the middle meatus. So once if you assume this is the lateral wall of nasal cavity, from here this is your middle turbinate, then this will be your uncinate, this will be your bulla ethmoidalis. Assuming I am moving from here, my endoscope is going from here to there. First you will encounter the uncinate bone, then the hiatus semilunaris, that is a gap, and then a bulged out area that will be the anterior most ethmoidal cell, that is the bulla ethmoidalis. This to be your middle turbinate. Okay, now what is this Hellar cell and the Onidi cell? So these are two cells which are very frequently asked. Now Hellar cell is a cell which is related to the floor of the orbit, and Onidi cell is a cell which is related with optic nerve. So easy to remember, O for O, that is. So you many times you know the concept but you forget in exam. So what is the way? You have to make a trick while you are learning something. So O for O. O is for optic nerve and not for Haller cell. Haller cell is for floor of the orbit. Now anything which forms the floor of the orbit will be the roof of maxillary sinus. So assuming this is your orbit, this is your orbital floor, so this will be your maxillary sinus. So it forms anything which is the floor of the orbit will be the roof of the maxillary sinus. Okay, so also the Haller cell, if they ask you in turn, the Haller cell is related to the floor of the orbit and roof of the maxillary sinus. Okay, so both are correct. So this floor of the orbit along with the floor of the anterior ethmoids, sometimes a cell is present, sometimes a pneumatization is there, which is called Haller cell, and Onidi cells is related to the optic nerve. So it is around the means lateral to the sphenoid sinus. And why it is very important? Because during surgery, if you are not very precautious, you might injure the optic nerve, because the optic nerve lies in relation to the Onidi cell. So it is very important to see the CT scan before you operate any patient and see and find the Onidi cell. So these two are asked repeatedly because they are very important in the management and in the theory aspect also. Now if you see a general term for any nasal pathology, the investigation of choice nowadays is you see and diagnose, that is diagnostic nasal endoscopy, and the treatment is endoscopic sinus surgery. Now in functional endoscopic sinus surgery, the concept is you don't injure the mucosa, that is why it is called functional. But if there is any pathology, you need to remove the pathology, that is any malignancy, then you do endoscopy sinus surgery and not always the functional endoscopic sinus surgery. There is another variation called concha bullosa, which is the pneumatization of turbinate, and specifically middle turbinate. So it is a pathological structure. So if you see a very large and big middle turbinate, it is the pneumatization of middle turbinate, which is called concha bullosa. So it can occur due to any injury. It can occur any injury due to any trauma to the middle turbinate, the air cells, the air got trapped and it causes pneumatization. So the concha bullosa is again repeating the pneumatization of middle turbinate, and it can arise due to trauma and any other cause. So moving to the MCQ section, because what is more important now is to get the concept and simultaneously solve some important MCQs. Okay, so we'll move to the MCQs important part. So I have it in my notes. Okay, so cancel. So if you see the commonest presentation of an infant, they are saying, I'll mark it for you. Okay, so the commonest